So I wake up on my birthday ready to get my blood drawn. It had been about 4 or 5 days, and I had been in a pretty good amount of pain. At that point, my doctor was worried I maybe had pancreatitis. So on the way to getting my blood drawn, we stop at the pharmacy to pick up some anti-anxiety medication for me. Because even though I'm in a lot of pain, I'm still really afraid of needles, and sometimes drugs help. As I try to pick up these medications, the pharmacist says, "Hey, your insurance didn't go through." And I go, "That's weird." So I check my email, and sure enough, I have an email from my insurance company saying, "Your payment didn't go through. Your insurance is canceled." So I call them up. I say, "What the hell? What's going on?" And they say, "Your payment for this month and the previous month didn't go through. The previous month, they had withdrawn the payment for my insurance premium from the wrong bank account, as in not my bank account." So I'd actually gone to the bank and gotten a set of checks and a copy of my bank statement and re-entered all that information to make sure it was correct. So I'm on the phone with the insurance company saying, "Look, I am thrilled to pay you. Let me pay you right now. Let me get my credit card out and pay you now." And they say, "We're sorry, nothing we can do. You need to call the ACA marketplace," because that's where I'd gotten my insurance through. So before I do that, I actually call my bank to make sure I'd done everything correctly. And the answer is, yeah, I hadn't made a mistake that time. They'd withdrawn the money and then refunded the money for whatever reason. So I call the insurance company back and they say, "Same answer, call the ACA marketplace." But by that time, I actually have another appointment. I have to go to the dentist. So I get done with that and I am wiped out. I have been in a lot of pain all day, and all I want to do is maybe have like a nice, very light birthday dinner. But my husband has a migraine. See, he hasn't been able to go to his doctor because his doctor has been booked solid all month, and his doctor won't prescribe him more medication for his migraines until he lays eyes on my husband again. So my husband goes to bed, and that's my birthday. So instead of calling the day a total loss, it's still really early, I decide to stay up just a little later, center my thoughts, have a little me time, put on a movie. I put on Saw. The political message of Saw is confused at best, but to the extent it does have a political message, here's what it is. The American medical system is torture.
So, sometime in the late 1990s, early 2000s, a couple of guys cross paths whilst they're at art school together in Australia. They bond over a shared fondness for zombie movies, old monster films, slasher killers, schlock. When they graduate, they decide they're going to make a feature film together, but here's the thing. Feature films, especially if you're two new graduates with big ideas, are really expensive to make. So they come up with an idea that involves shooting in one location, because that's cheap. And in the end, it turns out that Bruce Willis was dead the entire time, Kevin Spacey was Kaiser Soze, and the dead body on the floor in between the two men was veteran character actor Tobin Bell, who gets up, says, "Game over," and then Charlie Clouser's unreasonably sick Saw main theme kicks in, credits roll. It made $103 million. If you never watched any of the Saw films, or you don't know anything about them, what you do know probably has some connection to the term torture porn. This was a pretty contentious label that was slapped onto a whole bunch of films from the early to mid 2000s, which tended to focus on extreme bodily suffering and graphic depictions of gore. Plots were kept simple and repetitious, and characters mainly functioned as a delivery system for the violence and precious little else. The reason that this film franchise got connected to that term is pretty immediately obvious. As the franchise developed, the traps evolved, moving from being chained to a radiator in a decaying industrial warehouse to Baroque technical displays of violence. Blades, vices, poisons, and anything else that can reduce the human body to just so much meat and bright red corn syrup. And yes, that does mean that on the surface at least, the Saw films and that entire franchise could easily fit within the limited little box of torture porn. But the franchise rapidly becomes something bigger, something more ambitious, and something much, much weirder. Okay, so for people who have never seen the films, I'm going to try and summarize in kind of big picture terms what the franchise is about. And anyone who has seen the films is going to get very annoyed with me because I am going to leave so much out. And that's because, and I can't stress this enough, these films have a completely unreasonable amount of lore. There is a video online that gives the full detailed backstory of one character. It's almost an hour long. So the film franchise is essentially two trilogies, followed by a capstone film that was made in 3D, followed by a boring attempt to beat some money out of the dead horse a couple of years later, followed by an even more boring attempt to do the same thing a couple of years after that, which for some reason starred Chris Rock? What? The Saw franchise revolves around the work and philosophy of John Kramer, played by the very weird and deeply charismatic Tobin Bell. Kramer is an engineer who, after being diagnosed with an inoperable brain tumor, suffering the loss of his unborn child, and a near-death experience in a car accident, is reborn, someone with a philosophy of appreciating the life that you have. He becomes kind of evangelical in this, setting out to test people who in some way are not appreciating their life. And the way to do this is to place those subjects into a game where they're forced to make a horrifying choice, usually revolving around bodily suffering. Thus the franchise's famous slogan, "Live or die. Make your choice." The first three films follow John Kramer, who has the technical and financial resources of a Bond supervillain, whilst also being very much dying. Kramer dies at the end of the third film, setting up a much-teased plot or revenge strategy that will be unfolded in the sequels. He's replaced as the hero of the film by Costas Mandylor, which is a choice, but it's a choice that the writers seem to be aware of because Bell will be brought back to reprise his role in flashbacks, videotapes, voice notes, and voicemails. The plot essentially boils down to an exploration of corrupt police institutions in the present, combined with Kramer's ever-evolving and posthumous revenge schemes as he seeks to keep torturing people into appreciating their life from beyond the grave like the world's most persistent libertarian ghost. So here's why the films might initially fit within the idea of torture porn, but carry with them too much complexity and ambition to fit comfortably within that label. The Saw films are, in a way, about often deeply opaque structural forces, rules, games, institutions, focalized through the quite literal bodily suffering for those who have to live through them. Value your life is the message of the films, right? But value is mediated, placed in relation to a number of other discourses. And all of this becomes really clear in the sixth film of the franchise, in which John Kramer, from beyond the grave, seeks to test the will to live of the insurance executive who was responsible for denying his application for help with the cost of treating his terminal brain cancer. The Saw films tell us over and over again that they are about valuing your life, the value of life. Thus, if we're talking about a world in which health is linked to the realm of economics, then that value, well, that becomes something that we can put a dollar amount on. Thus, by proxy, we can turn human life into a commodity. Life, then, is not just something to be appreciated, but something to be managed as an asset class. Now, as a result, this spirals outwards into a whole host of other interesting discourses about managing oneself, about investing in oneself. But really, what this idea of life as an asset misses is the contingency of human existence, right? So, you might get a headache one afternoon and decide that you're going to stop drinking coffee past lunch. So you switch to green tea instead. Everyone tells you that's much healthier. A few months later, you find out that you're going to die, and soon. Insurance, or to put this another way, the profitable management of the human asset class, is an attempt to abstract away the contingency and fragility of human existence and replace it with the naturalized laws of the market. Obviously, this only works at scale, too. I mean, you can only mitigate the contingency of the individual with a big enough risk pool. And this is the reality of human subjectivity that Saw, in its weird, ambitious, and often very badly done way, is trying to explore. I mean, what kind of appreciation is even possible under these conditions? And it turns out that John Kramer's answer to this question is pretty molecular. The individual is at the mercy of market forces which transcode life into a manageable and profitable asset class. So for Kramer, the question becomes, how much are you willing to lose? The films make this quite literal, right? How much of the body are you willing to give up, to mutilate, or to cut off in order to survive? Kramer believes that there's some essence of humanity that will be liberated through this process. So Kramer's philosophy is thus the inverse of these abstract reifications of the insurance industry. As Saw 6 points out, there is a threshold beyond which life just isn't worth it anymore. As Kramer says to the insurance executive, this isn't about money. He has money. This is about principle, a particular understanding of what life is and what it truly means to appreciate it. So here's the choice. What is life? Is it something that is bound up within our very flesh and blood, something that we have to suffer through, something that we have to lose pieces of ourselves for in order to appreciate? Or is this value a completely abstract entity, something that exists in a company ledger, a line in a spreadsheet that will be deleted when it's no longer profitable? Self-interest or self-annihilation? There's a third choice here, and it's one that is engaged with fairly inconsistently throughout the franchise. But it is a way that represents perhaps a more hopeful understanding of just what life is and how it should be understood. What if, instead of thinking in terms of individual life, we thought of it in terms of social being, of life which is not vanished into capitalist liquidity, but is found and understood in its relations to other forms of life? Somewhat weirdly, one film in the franchise seems to understand this. In Saw 5, 5 individuals are placed in a series of games. They're told that their instincts will tell them to do one thing, but if they want to survive, they should try and do the opposite. Naturally, of course, they all turn on one another until there are only 2 survivors who make it to the final game. However, it turns out that if they had talked, communicated, and understood their own network of relations, all of them could have lived to the very end. Caught between ideological structures that inculcates a vicious self-interest or a subjectivity that immolates itself into capitalist abstraction, Saw as a series brings out the importance of constructing a social ontology. Appreciating life has to begin from the principle that life is maintained, shared, and reproduced collectively. And proceeding from that starting point is not only maybe revolutionary, but in the world that we find ourselves living in, it might be the only way that we'll survive. Live or die. Make your choice.
So, here's the state of the American healthcare system. In 2010, we passed the Affordable Care Act, also known as Obamacare, originally proposed by the Heritage Foundation, a right-wing think tank. The Affordable Care Act was almost certainly intended to head off the popular movement for single payer. The ACA does not provide health care. It provides a financial subsidy to purchase health insurance for people who meet certain financial and work-related qualifications. If you earn more than, or perversely less than, the income requirements for that subsidy, you can be disqualified entirely, and that can cost you thousands, if not tens of thousands of dollars for that year. We do have programs for the elderly and the poor. Sort of. Medicare is our program for the elderly, 65 and older, and for disabled people who also meet certain income and work requirements. Frequently, people who are on Social Security disability are also on Medicare, but not always. In order to get on Social Security disability, you have to meet certain asset limits. And maybe you think that's fair. Maybe you think that a program that provides free health care to people should go to people who really need it, who are really poor. And, that's certainly a point of view. Unfortunately, the asset limits on these programs are really, really low. If you have a month of emergency fund, you're probably disqualified. Medicare has a lot of drawbacks as a program for the elderly as well. Currently, the Medicare eligibility age is 65. Well, if you were an African American man born in 1950, your average life expectancy at birth is only 61. For white men, it's 66. Even white women, the longest lived demographic, only make it to 72. That means that a hell of a lot of people pay into Medicare and never see any benefits. Medicaid, whose name is confusingly similar to Medicare, is primarily a program for impoverished people. Say that 10 times fast. Its qualifications vary from state to state, with the most conservative states basically only giving coverage to children and pregnant people. For instance, here in Texas, you can get Medicaid if you're an uninsured parent, but the income limits are incredibly low. You would have to make, as a single parent of 3, less than $277 per month to qualify. And income and assets owned by other people in the house, such as a parent or a boyfriend or a roommate, can absolutely count against you for eligibility. If you manage to get on one of these programs, staying on them becomes a full-time job. You have to file a lot of paperwork and make a lot of doctor's visits to prove that yes, you still have MS, and yes, they do check that sort of thing. That no, your employer still doesn't offer you insurance. No, your kids haven't moved out. No, you haven't gotten a financial windfall. It is exhausting. If you're on one of the programs that requires poverty, if you get married, suddenly your spouse's finances count against you and you can get kicked off. That's why a lot of disabled people do not get married in this country. Let's say you're a 27-year-old with cystic fibrosis and you decide to get married. Well, suddenly your spouse's income and assets count against you and you can very quickly lose healthcare because you no longer qualify for a poverty-based program. You get kicked off. Well, your medication as a person with cystic fibrosis can cost $10,000 a month easily. So your spouse is going to have to burn through their entire life savings, sell their car, and then you can get back on the program, maybe if you apply, and it'll take several months. That can kill you. If you live with a parent, your parent might be in the same boat, forced to spend all of their income, all of their life savings, just to take care of you. In some states, a parent or a friend can be reimbursed up to full-time hours for taking care of a loved one, but the reimbursement rates are miserable, between $9 and $12 an hour typically. And 40 hours is the maximum amount Medicare is willing to reimburse for. A lot of people need more than that. And so the families and lovers and friends of disabled people are put in this impossible situation where taking care of their loved one forces them into abject, dangerous poverty too. And that in turn forces disabled people into long-term care facilities. Those facilities are underfunded, understaffed, and lead to less quality of life and ultimately shorter life expectancies for people with serious disabilities. I feel like this high-level stuff doesn't really get at the misery caused by this system. I worked at a facility for developmentally disabled people, and we were routinely understaffed. We just didn't have the staff on hand to prevent falls. We didn't have the staff on hand to follow behavioral plans, which kept us and which kept other clients safe. I saw somebody swallow a toothbrush at one point. They had pica. That's a really common thing to have for people with developmental disabilities who have a lot of needs. I had a client who people weren't able to be really consistent with their behavioral plan, and that client broke my hand. We were so understaffed that the facility resorted to threats to keep people there long past the 8 hours they were scheduled for. I worked 16 hours per shift pretty frequently. The Department of Labor had to intervene at the facility where I worked because we were not being paid anything for hours worked more than 40 hours. We weren't getting overtime. We weren't even getting our regular pay. And if we left, that would be considered neglect. Whenever somebody fell, there would be a criminal investigation into who was responsible for that fall. And let me tell you, it was never the management who understaffed us. And I can only really talk about my experiences as a laborer. I can't go into more specifics into how this affected clients because perversely, those abuses are covered by HIPAA. And because there were criminal consequences to something like a fall, because it could be determined that a fall was caused by neglect, people in that facility, workers in that facility, sold each other out all the time because remember, these were people making between $9 and $12 per hour. They couldn't afford to lose that job, and they really couldn't afford to go to jail over it. There is this incredible culture of silence around direct care work, the work of taking care of elderly and disabled people, because it's underpaid, often paid less than minimum wage. Legally, you are legally allowed to pay direct care workers less than a minimum wage. They do the work understaffed. They do it in horrible circumstances. And then when the inevitable happens and they fail and somebody falls or somebody dies, they are criminally prosecuted. Let's zoom back out a little and talk about dental and vision care. These are covered in some states for children by Medicare and Medicaid. Otherwise, nope. I want to underline how really strange this is. Your teeth and your eyes are part of your body, and people do die of things like abscessed teeth all the time. The problem is that you can go to the ER with an abscessed tooth, but they don't have the facilities to really treat the underlying cause. And without health insurance, you probably can't afford to get that treated. As for vision, macular degeneration, a progressive illness that eventually leads to blindness, runs in my family. And the routine vision checkups that would catch the early stages of macular degeneration aren't covered by Medicare or Medicaid. I don't have vision insurance right now, and I don't have dental insurance either. And that latter one is especially a problem for me because I had an illness that made me vomit a lot as a teen, and I was neglected as a kid, and I was poor as an adult, and my teeth are wrecked. I have to get everything capped, and it's expensive. That means in practical terms, kids might not be on the table for me. I have a disabled husband, and I'm in this weird gray area where I can work, but my ability to work comes and goes, and that means that I probably can't get on disability. I'm pretty scared for my future. My mother had similar health problems to me, and she got fired because she had to go to the ER with kidney failure on one of her shifts. She died 3 days later, broke in a hotel room far from her family. And you want to know the fucked up thing about that, the really fucked up thing about that? My mother was a healthcare worker. She ran a clinic. She was a physician's assistant, which is kind of like being a nurse practitioner. So even she couldn't get the care she needed and keep a job. My grandma asked me if I thought my mom died in pain, and I lied to her. If Mom didn't have to work sick, if she didn't have to worry about working, I wonder if we would still have her. I've never been any kind of medical practitioner the way my mother was, but I worked my way up from that direct care role into a social work role. I eventually coordinated care between medical practitioners on behalf of disabled clients. So I get both what it's like to be a provider of care for disabled people, and I get also what it's like to have disabilities, to be really sick. And I understand that there is an incredible amount of rage at providers in this system. One of the first victims in the Saw series, and the most significant, despite not having a lot of screen time, is Dr. Gordon. He's played by Carrie Elways, doing the worst American accent I have ever heard in my entire life. Spoilers for this 2-decade-old movie, but in the first movie, he's locked in a bathroom with a corpse and another man who appears to be unrelated. Well, this unrelated guy was a private investigator who was hired by the villain, Jigsaw, to spy on Dr. Gordon. Gordon was chosen because he failed to catch Jigsaw's brain cancer. Dr. Gordon is clearly the primary target of the violence of the first movie. But perhaps to its detriment, Saw is a franchise that can't quite commit to letting Jigsaw be definitively wrong. A better Saw with a less confused social message would probably look a lot like Squid Game, whose focus is on debt rather than on healthcare. I'm not going to spoil Squid Game for you, but if you pay really close attention, there is what I think is an homage to Jigsaw's backstory in the backstory of the Squid Game mastermind, and I think that's pretty cool. In the same way, Tobin Bell is just too charismatic to fire. He's also maybe too charismatic to fully condemn as wrong in the way Squid Game rejects its antagonists. There are, however, hints that maybe his motives are not what he claims they are. The first trap we ever see is straight up revenge against a wealthy doctor who was glib about Jigsaw's terminal cancer diagnosis. In fact, Jigsaw is literally hiding as the corpse on the floor of the dirty bathroom where Dr. Gordon was trapped. And if Gordon had taken the time to look a little closer, he might have recognized this as his patient. And for all of Jigsaw's bluster about setting up these traps to teach people to appreciate their lives, this second motive, rage over being overlooked as a dying cancer patient, is maybe the more compelling motive. Saw 3D has a second clue that Jigsaw is not entirely reliable. There's a support group for Jigsaw's victims. While a lot of them do end up his apprentices, fully bought into the whole Jigsaw philosophy, a significant number are disfigured and traumatized and resent it. And for a guy who is supposedly trying to teach people to appreciate their lives better, he's not just going out and picking random nihilists, for the most part. He is picking people who are sick, or who he met because he was sick. In Saw 6, one of those people was an insurance executive who denied his care. Now, Jigsaw is wealthy, so he could have paid for his own treatment, but he declined care out of spite and perhaps a sense that it would be unfair for him to live if other people in his situation would die. Saw 6 came out around the time the ACA was being seriously debated, and our point of view character is the insurance executive that Jigsaw talked to. The traps he's forced to navigate closely mirror his work, the power to decide who lives and who dies horribly. But this time, the deaths are at a distance the executive can't look away from. Jigsaw is taking this rich asshole by the scruff and rubbing his nose in the reality of what he does every day. This was a ripped from the headlines plot that pretty closely mirrored the discourse of the day, those evil insurance companies rationing care. And do not fucking get me wrong, insurance companies are evil. They make money by refusing to pay for care, but hospitals, clinics, and other providers are not innocent here. In most states, they do not have and are not required to keep a consistent set of prices on hand. So you as a consumer are not able to comparison shop or anticipate costs. And even if they did, it wouldn't matter that much because medical prices are subject to what's called inflexible demand. Most of the time, when we talk about Econ 101, we're talking about flexible demand. Demand goes up, prices go up. Demand goes down, prices go down. That is flexible demand. Medical care is subject to inflexible demand, prices go up, demand remains steady. And that's because, you can't really put a price on your health, because when you're unhealthy, you're in a lot of pain or you die. And the result of that is that prices can go absolutely insane and people will have to pay them. Even nonprofit hospitals in America are nonprofit only in the sense that they are structured in a particular way. They use fund accounting. They still extract massive amounts of capital from working people. So the problem is so much bigger than health insurance. The problem is the financialization of healthcare. The problem is that these financial interests have sort of enmeshed themselves with not just insurance companies, but clinics, hospitals, long-term care facilities, and use the inflexible demand of those services to suck capital out of working people. Here's a frightening statistic. About half of everybody gets cancer. If you live in America, you then have a 50% chance of, within 2 years of your cancer diagnosis, burning through your life savings. And that is not in exchange for a cure. You may be barfing your brains out on chemo and scrambling to find a way to pay for that chemo and food and housing and everything else you need to pay for in your life. Those medical bankruptcies are not just numbers on a page. Those are people who die because they can't afford additional treatment. They're people who work long past their planned retirement because they can't afford to retire anymore. They're sick, they're scared, they are miserable, and the wealth sucked out of people at the cost of the misery of millions is not abstract either. The wealthy live lives of absurd luxury on the backs of the poor. We on the left like to point out repeatedly that Medicare for All would be cheaper than the current state of affairs. In fact, Medicare for All is already the compromise. We could be demanding the nationalization of the provider side, clinics and hospitals as well. Even just the more conservative option of only nationalizing insurance would save billions and billions of dollars per year. It would save thousands of hours of trying to navigate all of these fragmented insurance schemes. We fall into this trap of showing people single payer over and over again. It makes financial sense, it makes ethical sense, and we think that somehow it'll connect with people and it'll just happen someday, because it has to happen, because it's the most rational thing to happen. What I want you to consider is an old man with cancer, an old guy who now has to work well past retirement at a lot less money than he would otherwise if he were not desperate. I want you to consider how much suffering that represents, how many people are going through this right now. And I want you to consider that this isn't an accident. It's the goal. The rich ideologically believe in the hierarchy that creates rich people because it has them at the top. They want this system and they benefit from it. A desperate, broke workforce works for cheap. And how do you create a desperate, broke workforce? You make them sick. You chain them to employer-based health coverage. You make every option other than employer-based health coverage punishing. And then you make everyone compete for a limited number of resources. In other words, you torture them.